We're going to continue and talk a little bit about the cholinergic drugs. If you think back with the adrenergic drugs, the alpha adrenergic responses were vasoconstriction and CNS stimulation. The beta 1 adrenergic responses were primarily on the heart. The beta 2 adrenergic responses were located in the smooth muscle of the bronchioles, the arterioles, and the visceral organs. The dopanergic responses cause dilation of the renal, mesenteric, coronary, and cerebral vessels. Sympatometic drugs, or inotropes, they were organic compounds that were also known to cause what reflex? Well, the fight or flight. So today we're going to talk about the parasympathetic system and their responses and the drugs that this system is responsible. So the other one was fight or flight. With the parasympathetic, it's rest and digest reflexes. It's part of having a normal physiologic balance in your body. The two systems are the yin and the yang for each other, and it should help as you're learning these two systems to keep those two ideas apart. Remembering what's adrenergic, the things that stimulate, and then what is the sympathetic or the parasympathetic, which is the calming, relaxing side. About receptors on the cells shouldn't be anything new to you guys. We've been talking a lot about receptor cells. For the cholinergic receptors, there's two types, and they're determined by location and the action once it's stimulated. There's nicotinic receptors and muscarinic receptors. The nicotinic receptors are located in the ganglia of both the parasympathetic nervous system and the sympathetic nervous system. It's named nicotinic because they can be stimulated by the alkaloid nicotine. So if you think about the effects that cigarettes have on people because of the nicotine in them, you would be looking at a similar response. Muscarinic receptors are located postsynaptically in the effector organs of the parasympathetic nervous system. So in the smooth muscle, the cardiac muscle, and in the glands. They're named muscarinic because they can be stimulated by the alkaloid muscarine. You look at this illustration, you look at the fact that in the sympathetic nervous system, the nicotinic receptor is in the preganglionic fiber. You'll also see that it's in that same region in the parasympathetic nervous system. And if you look at the somatic nervous system, the nicotinic receptor is at the myoneural junction. Likewise, if you look at the muscarinic receptor, it's in the parasympathetic nervous system postganglionic fiber at the neuroeffector junction. The mechanism of action for cholinergic drugs is multi-phased. There's direct-acting cholinergic agonists, and they bind to the cholinergic receptors and activate them. The indirect acting cholinergic agonists are also known as cholinesterase inhibitors. They inhibit the enzyme acetylcholinesterase, which breaks down acetylcholine. It results in more acetylcholine being available at the receptors. In addition, the indirect acting cholinesterase inhibitors can be reversible, meaning that they bind to cholinesterase for short periods of time, or irreversible, which means they bind to cholinesterase for a long period of time. And they bind to cholinesterase to form a permanent covalent bond. The body must make new cholinesterase to break those bonds. So the drug effects are the effects seen when the parasympathetic nervous system is stimulated. The parasympathetic nervous system is the rest and digest system. And remember, we talked about how the sympathetic nervous system is fight or flight. So the rest and digest system means that this system activates the more tranquil functions of the body, those that help to maintain a healthy long-term balance. The body undergoes several specific responses when the parasympathetic system is activated, like your saliva is increased, your digestive enzymes are released, your heart rate drops, the bronchial tubes in your lungs constrict, your muscles relax, the pupils of your eyes constrict, and your urinary output increases. All of these changes are designed to maintain long-term health, improve digestion, conserve energy, and maintain a healthy balance in your body's systems. At recommended doses, cholinergics primarily affect the muscarinic receptors. At higher doses, the cholinergics stimulate the nicotinic receptors. The desired effects are from the muscarinic receptor stimulation. Many of the undesirable effects are caused by stimulation of the nicotinic receptors. Here's your first question. The nurse is assessing a patient who has been taking a cholinergic drug for 3 days. The patient has flushed skin, orthostatic blood pressure changes, and is complaining of abdominal cramps and nausea. The nurse recognizes that the patient is most likely experiencing what? Early signs of a cholinergic crisis, late signs of a cholinergic crisis, an allergic reaction to the drug, or unexpected adverse effects. So the correct answer to this one is that they're experiencing early signs of a cholinergic crisis. The items listed are early signs which can become more severe and lead to hypotension, circulatory collapse, bloody diarrhea, shock, and cardiac arrest. Remember, these drugs do the opposite of adrenergic drugs. So if you think about it, all of these symptoms are related to dilation of the blood vessels. The adrenergic drugs cause constriction. The cholinergic drugs cause dilation and relaxation. The direct-acting cholinergic drugs are indicated to reduce intraocular pressure. They're useful for glaucoma and intraocular surgery, and they include things like ecothiopate, carbachol, and pilocarpine. The topical application is used because of poor oral absorption. The direct-acting drug bethanechol increases the tone and motility of the bladder and the gastrointestinal tract. It relaxes the sphincter in the bladder and the GI tract, allowing them to empty. They're helpful for post-surgery atony of the bladder and the GI tract. An oral dose or subcutaneous injection is how this drug is given. Cevimeline is used to treat excessively dry mouth, which is also known as xerostomia. It can result from a disorder known as Sjogren's syndrome. And if you look at this picture, you can see how dry the tongue looks. The direct-acting drug succinylcholine is used as a neuromuscular blocker in general anesthesia. The indications for indirect-acting cholinergic drugs are to increase acetylcholine concentrations at the receptor sites. This leads to stimulation of the effector cells. It causes skeletal muscle contractions, and it's used for diagnosis and treatment of myasthenia gravis. It's also used to reverse neuromuscular blocking drugs. It can be used to reverse anticholinergic poisoning, which means it's an antidote. And examples of these drugs include bisostigmine and pyridostigmine. Indirect-acting anticholinesterase drugs are used for the treatment of mild to moderate Alzheimer's disease. So these are some of these drugs that you probably have heard on TV, like Aricept and Exelon. So get used to the generic names. So Aricept is donepezil, and Rezidine is galantamine, and Exelon is rivastigmine. Memantine, or Namenda, is not a cholinergic drug. However, it also is used in the treatment of Alzheimer's disease. Contraindications include known drug allergy, GI or genital urinary tract obstruction. Remember, causes relaxation. It means things fill up. Bradycardia. Remember that this is a drug that slows things down. So bradycardia that was already existing would not be something that you would want to have happen or be encouraged by these drugs. Defects in cardiac impulse conduction, hyperthyroidism, epilepsy, hypotension, chronic obstructive pulmonary disease. Remember, these drugs cause constriction of the bronchioles, so we don't want to give something that's doing that to somebody who already has an obstructive pulmonary disease, and Parkinson's disease. Adverse effects of cholinergic drugs include the result of overstimulation of the parasympathetic nervous system. So in the cardiovascular system, we would have bradycardia, hypotension, syncope, conduction abnormalities like AV block, and cardiac arrest. In the central nervous system, we would have headache, dizziness, convulsions, and ataxia. Gastrointestinally, we would have abdominal cramps, increased secretions, nausea, and vomiting. I think the next slide has a few more things on it, but you can read those on your own. Cholinergic crisis is circulatory collapse. There's hypotension, bloody diarrhea, shock, and cardiac arrest. Sludge, which stands for salivation, lacrimation, urinary incontinence, diarrhea, GI cramps, and emesis, is a mnemonic that's used to talk about the signs and symptoms leading to cholinergic crisis. The early signs include abdominal cramps, salivation, flushing of the skin, nausea and vomiting, transient syncope, transient complete heart block, dyspnea, and orthostatic hypotension. Treatment in the early phase of cholinergic crisis includes the use of atropine, which is a cholinergic antagonist. Treatment of severe cardiovascular reactions or bronchoconstriction is treated with epinephrine and adrenergic agonists. Adrenergic agonists are meds that do what? Well, they stimulate the adrenergic receptors, which result in bronchodilation and cardiovascular constriction. So if you have somebody who is bradycardic and they are not, and their blood pressure is dropping out of on them, then you would want to give them an adrenergic drug that would cause constriction of the blood vessels and relaxation of the bronchioles. Some of the interactions that we need to be concerned about with cholinergic drugs is obviously anticholinergics are going to cause the opposite effect. Antihistamines also will cause the opposite effects, and symptomatic. They will antagonize the cholinergic drugs, and that results in decreased responses. Of course, other cholinergic drugs will just give an additive effect. We talked briefly about bethanechol just a little bit ago, and it's a direct-acting cholinergic agonist. Its use is for the treatment of acute, post-operative, and postpartum non-obstructive urinary retention, and for the management of urinary retention associated with neurogenic atony of the bladder. Contraindications for this drug include a known drug allergy, hyperthyroidism, peptic ulcer, active bronchial asthma, cardiac disease or coronary artery disease, epilepsy, and Parkinson's. Adverse effects of bethanechol include syncope, hypotension with reflex tachycardia, headache, seizure, GI upset, and asthma attacks. Its indications are that it's an anticholinesterase inhibitors. Donepezil, or Aricept, is a cholinesterase inhibitor that works centrally in the brain to increase the levels of acetylcholine by inhibiting acetylcholinesterase. Remember, esterases mean that it's breaking down the acetylcholine. It's used in the treatment of mild to moderate Alzheimer's disease. Similar cholinesterase inhibitors include galantamine and rivastigmine. The contraindications for donepezil is known drug allergy. Adverse effects include GI upset, including ulcer risk caused by increased gastric secretions, drowsiness, dizziness, insomnia, and muscle cramps. The effects on the cardiovascular system are complex and may include bradycardia, syncope, hypotension with reflex tachycardia, or hypertension. Interacting drugs are things like anticholinergics, which counteract donepezil's effects, and nonsteroidal anti-inflammatory drugs. Pyridostigmine is an indirect acting cholinergic drug that works to increase acetylcholine by inhibiting acetylcholinesterase. Its use is for myasthenia gravis. Edrophonium or tensilon is an indirect acting cholinergic drug that is used to diagnose myasthenia gravis. It can also be used to differentiate between myasthenia gravis and cholinergic crisis. Neostigmine, pyridostigmine, and physiostigmine are used to reverse the effect of non-depolarizing neuromuscular blocking drugs. Big long word. Also in treating severe overdoses of tricyclic antidepressants and an antidote after toxic exposure to non-drug anticholinergic agents, including those used in chemical warfare. So like we said when we talked about herbs, often herbal remedies are still drugs in that they stimulate different things in the body just like their synthetic partners do. So one of the herbal products that's a cholinergic drug is ginkgo. Its common use is to prevent memory loss, for vertigo, or tinnitus. It may cause GI upset, headache, and bleeding. There's potential interactions between ginkgo and aspirin and other NSAIDs, anticoagulants, and anticonvulsants. So here's question number 2. A 60-year-old woman asked the nurse about taking ginkgo to help her with her memory. The patient has a history of arthritis, type 2 diabetes, thyroid disease, and hypertension. She's currently taking NSAIDs for the arthritis, oral anti-diabetic medications, thyroid replacement hormone, and a beta blocker for blood pressure. What potential adverse effects from the ginkgo would be of most concern for this patient? Stomach upset, diarrhea, bleeding, or drowsiness? Well, the answer is C, bleeding. And the rationale for that is that the potential adverse effects of ginkgo include stomach or intestinal upset, headache, bleeding, and allergic skin reaction. Potential drug interactions include aspirins and NSAIDs, anticoagulants, and other drugs. The ginkgo may interact with the NSAID medication that she's using, causing increased risk for bleeding. The nursing implications for cholinergic drugs include that these drugs will stimulate the parasympathetic nervous system and mimic the action of acetylcholine. You want to assess for allergies, the presence of GI or GU obstructions, asthma, peptic ulcer disease, and coronary artery disease. Let's add to this list COPD as well, since it also will have people with that will also have problems if they were to take cholinergic drugs. You want to perform baseline assessment of vital signs and a systems review. Medication should be taken as ordered and not abruptly stopped. Doses should be spread evenly apart to optimize the effects of the medication. Overdosing can cause life-threatening problems. Patients should not adjust dosages unless directed by their healthcare provider. Here's another question for you. A patient is scheduled to have lunch at noon. The nurse will administer the pyridostigmine, Mestelon at what time for optimal therapeutic effect? 11 o'clock, 11:30, 12, or 12:30? Well, the answer for this one is 11:30. The drug should be taken 30 minutes before a meal for maximal therapeutic effect. You want to encourage patients with myasthenia gravis to take their medication 30 minutes before eating to help improve their chewing and swallowing. One of the problems that people with myasthenia gravis has is aspirations. So these medications help them to not aspirate. When cholinergic drugs are prescribed for Alzheimer's disease, be honest with the caregivers and the patients. Tell them that the drugs are for the management of their symptoms, but will not cure them of their Alzheimer's. The therapeutic effect of anti-Alzheimer's drugs may not occur for up to 6 weeks, so they need to be patient and wait for the results to happen. Next question. A patient with Alzheimer's disease accidentally took 2 weeks' worth of cholinergic medication. He is brought to the emergency department, is going into shock, and experiencing severe hypotension and vomiting. The nurse will expect which initial treatment? Administration of physiostigmate, administration of atropine, administration of epinephrine, cardiovascular support with dopamine. As we talked about earlier, the answer to this question is B, administration of atropine. Atropine can be given to reverse the effects of an overdose of a cholinergic drug. Atropine is an antidote for cholinergics, and it should be available in the patient's room for immediate use if needed. Patients should notify their physicians if they experience muscle weakness, abdominal cramps, diarrhea, or difficulty breathing. You definitely want to monitor for therapeutic effects. You should see signs and symptoms of myasthenia gravis being alleviated. In postoperative patients with decreased GI peristalsis, you want to monitor for increased bowel sounds, passage of flatus or gas, occurrence of bowel movements. You definitely want to monitor for therapeutic effects in patients with urinary retention or hypotonic bladder. Urination should occur within 60 minutes of the administration of bethanechol. In patients with Alzheimer's disease, you should see an improvement in their symptoms, improvement in mood, and decrease in confusion. Finally, as with any drug, you want to monitor for adverse effects.